Welcome back to Integrated Sports Medicine YouTube channel. Today we're going to answer some questions that you asked us on Instagram the past couple of weeks.
All right, moving along to a little bit of a different topic. We're going to defer this question over to Dr. Ashley Neal, who has 11 years of clinical experience and has been with Integrated that entire time, like Laura. So this question is going to deal with some pelvic floor stuff and seeing women postpartum, which obviously is not something we see a ton of, but we do see women with some issues, and it is something that comes up with a lot of our low back pain patients. So the question is, do you see women postpartum? And if so, do you ever anticipate that there may be some issues with pelvic floor weakness when you see them postpartum?
Most of the women that we see postpartum are coming in to see us anywhere from 3 to 4 months following their delivery. We would see women post-vaginal or cesarean deliveries. Most of the issues that are presented to us are usually regarding core weakness, rectus diastasis, which is a separation of the abdominal musculature, as well as pelvic floor weakness. Most of the time we would go ahead and start a person on a program to help increase their pelvic floor strength through verbal and tactile cues externally through palpation to abdominal musculature, as well as stabilization exercises with various equipment, as well as Pilates instruction. Most of the time, these women are also having back pain or poor mechanics due to nursing, as well as obviously lifting their newborn, carrying them around, juggling the day-to-day activities of motherhood. So we oftentimes address all of those mechanical issues as well and help promote optimal body mechanics throughout all those aspects.
Yeah, I think that's a good point, especially carrying those baby carriers from the car in and out of places too. So to add on to that, so if someone did come to you, or just say someone asked you, in passing, what are a couple tips or things you might tell someone to help strengthen their pelvic floor after they've, just recently had a baby or several months ago, had a baby?
We would talk about exercises to steer clear from, as well as those exercises to help promote strengthening of your abdominal musculature, as well as their glute and their hip girdle as well. Oftentimes, hip, core, and glute weakness all coincide with one another. And if you kind of work to improve the strength of all of those aspects of those muscles specifically, it will help to decrease pain, pelvic floor dysfunction, including things like incontinence or overall weakness throughout those muscles.
So basically we're saying you shouldn't have to cross your legs when you laugh, cough, or sneeze.
Exactly.
Just because you had a baby.
Yes.
Do you all have anything to add on to that with, women you've seen or worked with, or, clinical cases that you've had success with postpartum? Because obviously we're not a women's health clinic, but we do see women who have that need, sometimes beyond our scope, so we refer them out appropriately. But, for those that we can manage here, that we've done successfully, do you guys have any other tips or tricks to add on to that?
I get some questions about return to running after having given birth, and it's a very fluid answer, and it's going to be based more on your particular delivery and your general recovery as far as when you're cleared to return to kind of normal exercise activity, but making sure you meet certain goals, that you have good stability in your hips and your core, so that when you return to your regular exercise, running or lifting activities, that you do so with good mechanics, so that you don't end up with an additional injury and you can return safely. And we can help you kind of along that process to make sure you have a successful outcome.
I think along with that is the building the base, like you guys both said. I think a lot of times you just want to jump back into your previous form of exercise, whether that's planks or you think you can do your core workouts just as easily, but the building the base, like the transverse abdominis and some of the lower abdominal muscles that we don't think of as our abs, but that's where that Pilates comes into play. And all that. So I think that building the base and coming to therapy can help with that. We can really give you some good exercise to build that, so then you can go do your former strengthening stuff.
And we break it down a little bit to the basics for them so they can get back up without any re-injury. Okay. All right. Not always our favorite topic to talk about, but an important one. open this question up to all of you, so everyone can take a quick turn. Probably a very common thing we get asked after or during our first visit with that patient or the initial evaluation is, what should I expect in my follow-up visits as I'm going to be seeing you, once a week, twice a week, 3 times a week? Like, what's to be expected during those visits?
For your first return visit would be more introduction to exercises that are specific regarding the treatment of the impairments that you're coming in to see us for. We would do those exercises with you to show you how to properly perform them with good mechanics. And then there is always a hands-on component where we would address specific soft tissue restrictions, joint restrictions, muscle extensibility deficits, etc.
Go ahead, Katie.
So after your initial eval, I like to give at least a handful of either stretches or exercises and activities to take home with you, and I kind of explain it as a litmus test for seeing how you respond to those. So your first appointment back will be kind of discussing how your body responded, if you like them, don't like them, they kind of created some irritability, or if you were sore or fatigued from them, and then that way we can build up your home exercise program and adjust accordingly from there.
Go ahead, Corey.
For the hands-on portion, we have different techniques that we use, different interventions. So we do soft tissue work with our hands. We'll use tools that are called Graston tools. Dry needling. So several other therapists do dry needling. We've got definitely a good mix of interventions that we all do. Kinesio tape. We can tape up different body parts. We use different modalities as well to help with your pain and inflammation and to give you some relief.
And then we'll progress your home exercise. That is going to be the foundation of what we do in here. And it's important that you do it at home because that will help us out in the clinic to get to the newer level activities that we need to do to get you back to where you want to be.
We also use cupping.
Forgot
that one.
Okay, Laura.
Yeah, so kind of to summarize what you should expect from your physical therapy program, particularly on your initial evaluation and your follow-up, is going to be a combination of activities, so some hands-on work to encourage proper movement patterns, but also exercises to build on that movement pattern to ensure that you're moving correctly, performing the exercises that are specific to your injury or condition to make sure you're progressing and getting stronger and better at what you would like to do so that you can meet the goals that you want to achieve that you kind of discuss with your therapist. So everyone's on the same page for a positive outcome.
And how long would you say, each follow-up visit, like how long would you say you spend with that patient?
So most follow-up appointments are going to range from anywhere from about 45 minutes to even 75 minutes. Sometimes with a more complex patient or with a lot of our sports-oriented patients rehabbing from a surgery or an ACL reconstruction, you might be here a little bit longer than that, sometimes 90 minutes. That way you get a good exercise program in and we cover all of our bases to ensure that you have a proper recovery.
If there's any particular exercise you want demonstrated or have a very specific question about physical therapy, write it down in the comment section below. We will get back to you. And as always, like, comment, and subscribe.